we're going to go ahead and get started. If anybody jumps in a little later, we'll keep you up to speed. We're going to start with just going through like seated posture, and then we'll work through some things that kind of come along with that. So we're in our chair. We want to think about tucking up through like our pelvic floor and kind of sitting on our sit bones. So we're kind of driving the femur down. So it's going to really be like right in here. We're going to drive that into the chair, and then we're going to try to just sit as tall as we can, and then we can operate from here. The thing about this is it's pretty tough to stay here all day, especially if you have a desk job and you're required to sit in your desk all day. It makes it really tough. A lot of times people will start to slouch and they're working out in front, and that causes us to kind of shorten out in our upper back and our hip flexors. And then there's another posture we get is like people kind of tend to slouch sometimes too after they've been sitting for a while, and like the butt and the hamstrings underneath start to get a little bit tighter, and we can work from here, and you know, we end up shortening out tissue when we do that. Sometimes we get a little bit of a lean. Some people like to slouch, and we all kind of have different postures that we'll go through throughout the duration of being in like a seated position, and it's really tough to maintain a good posture the whole time we're sitting. And I totally understand that, especially for all my my desk workers out there. So one thing I always think is a great idea is to go with a standing desk, so you have that option, or even just like a rising desk topper. That's always a good thing. That gives you the option to stand up through some of your day, and it brings your computer up. It gets you a little bit more elevated, and it's a really good thing to have in your just like daily environment, so you get a little bit more exposure. And then we're going to go ahead through some of these postures here. So we'll start off with just a nice neutral position. Slide this down. So we'll go ahead and go through our neutral position for our squat and how it relates to like our seated position. So when we get into like a position here where we're lowering into our squat, we're able to engage our hip flexors, able to keep our core engaged, we're able to maintain a nice slight arch in the back, and then we're able to keep tension in the butt and the hamstrings. So like, that's a real big part about being able to engage that. So like if we're in that chair and we're rounded forward and we're working, a lot of times it's going to shorten us out and make us a little bit tight, and it gives us a little bit of just tension in the front side. And then if we're in the slouching position, we'll go into this next. It's going to end up with that posterior pelvic tilt. We talked about this last week, and we'll continue to address this today. With the posterior tilt, when we go into that squat, like the butt kind of tucks underneath as we lower down, the back starts to flatten out, and we end up taking on more stress in the back here as we have that happen, and like the muscles aren't engaging as well there, and we're not using like the back side of the leg as well as we could. They're kind of pulling the muscles, or pulling the pelvis underneath, and then we're definitely not using our hip flexors well when we do that, so we're not pulling ourselves into that squat position. So we want to just kind of address some of that stuff, get them loosened up, get some of the muscles activated. And we'll go ahead into our posterior pelvic tilt here. Just going to slide this out of the way. And when we go into addressing the posterior pelvic tilt, we want to get the hip flexors activated some. And then we're going to work on like pelvic positioning. And then we'll try to take that into a squat. So a lot of times we'll just go ahead and start with just messing around with that pelvic tilt. So you can kind of put your hands on the front of your hips. You find the bony spot right at the front, and then find the bony spot in the back with your thumb. And then we're going to kind of just rotate this. And you can kind of see how my hands kind of tip forward and back. And we want to think about like somebody that has a posterior tilt, they're already kind of tucked this way. So we're going to try to just teach them to like go up a little bit, get a little bit of an arch there, kind of feel those muscles working. And then again, I like to think about that breathing here with this. So breathing deep into our core, feel that expansion happen at the ribs. And then we can just kind of work on rocking here a little bit, find that neutral position where you got a slight bit of arch. And that's the first part. Kind of just get used to feeling that for you guys at posterior tilt. And then we're going to go into hip flexor activation. And we can do this a couple different ways, but one simple way that we can do this is just bringing one leg up and then pressing that leg into your hands. So you can create like a little bit of resistance with your hands and then make this hip flexor really drive into this leg, really drive into your hands there. Get a real good squeeze in the front of the thigh. You can go for like 3 sets to 15 seconds there. And then we'll switch to the other side. And you think about this position here is going to be the same as your squat. If you're pulling up with your hip flexors and you're engaging there, that's going to help you lower into that position. So we think about like as we pull into our squat, we're going to engage those hip flexors. It's going to help us pull into that position and squeezing through there. So we think about Terrence? We'll think about those muscles there engaging to help us pull down into that position. That's going to be a big part of it. And definitely the hip flexor drill helps to get that. And then the pelvic tilt position really helps people identify that that neutral arch. So like we don't want to have a flat back as we go into that squat. The next one we're going to go into is going to be our anterior pelvic tilt. I struggle with this one more when I go into my squats. A little bit tighter through like hip flexors. Hip flexors again, we're going to get pulled forward, and we'll address that with some foam rolling and get that to relax. And we talked about that some last week. And then we want to think about engaging through the core. So this comes from more of that forward position. So people that sit in their chair and they tend to lean more forward, like they end up getting a little bit more rounded upstairs in the middle of the back. And then the muscles in the front of the thighs, they usually shorten out more because they're not slouching, they're more forward, and that bends them more at the hips. And then what will happen with that is a lot of times they're not pulling up on the pelvis from the low abs, and that could be like a weakness or just maybe not as active because they've been kind of slouching on them all day. And then we'll end up with like more stress in the low back. We get a little extra arch in the back, more arch than we would want. And a lot of times posterior part of the leg is just not going to be as active. Butt and hamstrings aren't going to want to do as much work through there. So what I like to do for that is just going through some bridges. So we did these last week. We'll run through a quick refresher on those, and they'll help us get a little bit more engaged through the posterior chain. So getting the back of the legs going, we're going to tuck the toes up, and then we're thinking about getting the belly engaged. This is going to help us work on our abs, getting those more activated. And then I like to press into the floor and then just trying to lift from the butt. So we're lifting up from the butt and the hamstrings. And then what I like to think about here is trying to squeeze heels up towards the butt here and just really getting those hamstrings engaged as well. And then as we lower down, feel that stretching. So we might get like a 10-second hold and then maybe go for 3 or 4 of these and really just trying to get like some more neuromuscular activity going on, get some good connection from the brain to the muscles. And then I like to go into, we could use a plank here to help get the front side of this going. And we just set up into our plank position. We can do the same concept of holding 3 sets of 10 seconds, really trying to squeeze through the low abs, tucking the hips in from the pelvic floor, and then also just extending the legs. So we're squeezing through the front of the thighs, helps get good length through there. And we'll do 3 sets of 10 seconds on those, and that a lot of times will help us engage through there. And then I like to just go ahead and work on pulling into that position again with those hip flexors. So like sometimes when these are tight and they pull the pelvis forward, like they're like tight, but they're not like pulling as well as they should. And so we'll just try to work on pulling into that squat position as low as you can with the hip flexors. And like if you can't engage these anymore, then we'll just work on that depth and then keep working to get lower with that engagement. We don't want to just pull into that and let gravity sink us down into the bottom of our squat. We want to utilize our mental energy to those muscles to help us get into that position. And that's a really big part of that. And then going into the sway back position, so that is going to be the one where our hips are a little bit forward and the upper body kind of rounds forward. So a lot of times I start to teach this a little bit more of a hinge first, and then let's see, and then I will teach the squat after that. Let's see. So definitely take some practice there, Paul. So when you get the stiffness in your lower back, it's probably going to be an inactivity in the core. And then when you can get your pelvic floor involved, that really helps. So one thing I like to think about with that is kind of like doing a Kegel while you're in that position. And on the inhale, as we get that expansion, we're going to think pulling up from the pelvic floor. So I'm just going to pull the chair out for a second. And let's see, when we're sitting here, we want to think about pulling up from the pelvic floor in this position, and then inhale, feel that squeezing up, doing a Kegel on the inhale. Exhale, let that relax, and still trying to maintain that posture. So like we're not going to be squeezing the pelvic floor the whole time. We want to get that more in rhythm with our breath. And then like as we practice that mechanic, doing the breathing with the pelvic floor squeeze, that really helps us get that mechanic back to its normal state, and then it should become more of a natural thing. Like as you inhale, you get a little pelvic lift, and that will help you maintain that posture where you don't have to like squeeze your core super hard. Because we'd like to think about like if we're squeezing really hard, I'm trying to pinch this down, almost imagine it as like a tube of toothpaste. So like if you squeeze a tube of toothpaste in, the contents go away from that, right? So like if you're squeezing really hard, it's going to push down on your pelvic floor. But if you can breathe in, have that expand, so it's going to open up, and then you tuck up from the pelvic floor with that expansion, that's going to get you a little bit more optimal function out of your core. So hopefully that makes sense for you. If not, post another question in there and I'll try to answer that. But definitely getting the breathing mechanic going with your pelvic floor is absolutely key to keeping this. And it's not all scrunching down, but it's really just getting that air pressure called intra-abdominal pressure. And when we get that breathing mechanic going, it helps promote that intra-abdominal pressure. And then we don't have to work as hard on squeezing. It's just a matter of like getting that mechanic to function well there. I hope that answers your question. And then we're going to go into our sway back position. Now, like I said, with that, I usually would teach them, since they're already shifted forward, I want to try to teach them how to kind of just work on getting back. So just work on pushing the hips back, getting a little bit more like tall through their spine. A lot of times they'll end up pushing their hips back, and they kind of go into this position and round a little bit, and we want to just work on a little bit of extension through the thoracic spine, holding on to that, and then going back to that idea of intra-abdominal pressure, creating that air pressure with their core, and then just work on hinging. So just work on pushing the hips back, keeping some tension in the butt and hamstrings. A lot of times they're going to want to go into this, get some arch and then round, and it creates this like stress on the back. So once I get them through like the hinge mechanic, how to hold the core, how to keep that breathing mechanic going throughout that whole movement, then we'll start to teach the hips to go down and back as well. So they're getting that loading in the hamstring and glutes, and then they can start to sit down into that and start to take some tension on into the quads. And the first thing is definitely going to be working on hip flexors and the breathing. So we'll go through that same drill we went through earlier where we're laying on the back. You could do this standing and resist this and just trying to work that hip flexor driving up into the arms, really creating lots of tension with your mind. So you can hold on to that position, and then once you have that like neuromuscular connection, then we'll go ahead and try to utilize it, right? I'm just using the idea of squeezing in the hip flexors to pull my hips back. That's going to help me load back here a little bit better. Once you have that down, you can go ahead into the full squat, and you have that hinge action happening, squeezing in the hip flexors, and then you're just adding that knee bend and having that weight transfer back a little bit, and then you get like the quads a little bit more involved from there. And that's definitely a big one for getting people to kind of feel that and accept that load in the back of the leg as well as the front of the leg. Do you think about like if they're already kind of pushing here, they take on tension in the front of the legs already, so they have to learn how to kind of accept that in the back. I didn't draw the hip hike or the hip shift, that lateral shift, because it would be really, really tricky. But what I'll do is I will show you what it kind of looks like, and then we'll kind of talk through some of that stuff. So for me, sometimes I shift off to my right, and it's pretty easy for me to shift this way. But you can see I kind of pull over there, and I'm not using this inner thigh as well. I'm not using this glute as well. So what happens is it creates that little shift. And when we have that shift going on, we talked about this before, we want to address some of those opposite muscles there. So whatever side we're shifting towards, like the low back and the inner thighs on that side, they're going to end up taking on more tension. So like when I go into this and I shift, and I'm trying to do this on purpose some, this side is going to end up taking more tension in my low back, this inner thigh is going to take on more tension, and then this butt cheek is going to end up taking on more tension. And then I'm not using this inner thigh as well, I'm not using this butt cheek as well, definitely not using these obliques on this side as well, and it creates that shifting motion. And it's really common. A lot of people have a shift one way or the other. It's definitely a tough thing to address, but we want to go through some exercises to help do that. So if we know we have a shift and we can feel that we're picking up tension in different places, then what we'll do is we'll go ahead and we'll foam roll. We'll foam roll through those opposite areas. So like for my right adductor, I will go ahead and just put my leg up on there. I'm going to try to just cruise through, see if I can find anything tender. And then I'm just going to hang out, relax. I'm going to go through some spanning, try to get this to loosen up some. So I did this yesterday, and I don't feel too bad in here. But if I was to find something, I'd spend anywhere from 1 minute to 3 minutes on there, get that to relax. I would say no more than 5 minutes. And then I would hit the opposite glute. That opposite glute is going to be taking on more tension. So we get into like side plank position. Go ahead and cruise along here. See if you find anything tender. And then once you do, you go ahead and hang out. You can go through a little bit of range of motion with this leg, trying to lift it off the floor. Remember, this inner thigh is not going to be as active, so it might be tough to lift this leg off the ground, but this is a good place to get it started, right? I'm going to start activating this muscle just from here while I'm trying to get the outside of the leg to relax. So it's kind of a 2-for-1, and it's a great thing to do. And then for the low back area, since we're taking on tension in the same side low back, I will use something a little bit smaller than a foam roller, and would take, like, this is a 5-inch massage ball. You could use a 2.5-inch, would be fine. And then you can just stick that right in to, like, the low back area. What I like to do is kind of find the rib, find the pelvis, and find the spine. Find those 3 bony spots in your back, and then you're going to stick the ball right in the middle. So we're not going to go on the bony spots per se. We're going to go right into that soft tissue, and we're going to go ahead and just relax that as best we can. My favorite things to do there is get that diaphragmatic breathing going. It's definitely going to be a big part of it, and you'll notice if you're getting good expansion in your core while you're on that, that is going to help you get that area to relax a little bit better. With just your breathing and then a little bit of pressure on that part of the back. And then after we go through that, so we got the left glute to relax, we'll go ahead and get the right glute a little bit more tension. So we can lay on our side, we can do some lateral leg raises, and I would just do this mainly for the side that's not as active. So the other side's already holding a lot of tension. Maybe go for 2 sets of 15 here. I'm really getting some good mental tension here, getting that neuromuscular control going. And then we can work the inner thigh on the opposite side. One of my favorite things to do is to just take a band, and I'll set this up on, like, on a rail, or you can use a door anchor. And what I'll do is I'll just take this and I'll try to pull it across just to, like, the midline, and then I'm going to squeeze really good in this inner thigh and just work on holding some tension there and just really trying to mentally fire that muscle up. And once you do that, you start to feel your hips a little bit more balanced out. And then we might do something like, you can do a pale-off press, or you can do a side plank, something to help you activate the opposite obliques. Getting those really fired up is going to help. So you can kind of set up something on door anchor, or you can set it up on a rail, anything that's going to help you get going here. And then we're just going to work through, try to get the obliques to start working with us, and then we're going to try to hold tension pretty evenly through the sides, and then we're going to be working more on the obliques there. And I also like to think about here too, trying to pull the legs in. So I'm activating those inner thighs, really working through my whole system, trying to hold good tension in the neutral, and then working that action there. And then after you go through that, you should have a little bit more, like, balance. You have a little bit more sensory of some of those areas that aren't working as well. And then just take that back to your squat and try to keep everything nice and neutral there as you're working through your range of motion. So it'll be easier to kind of pull yourself straight down as opposed to having that shift happen. If we can get all that stuff going, get this pulling in, and I'm literally squatting better from that. You can see that I'm not pulling to the side as much. I can feel that I'm not pulling to the side as much. And it just really depends on, some of the things that we do. And remember, we'll think about, like, that lateral hip shift. It could come from sitting in your chair and sitting like this, right? I'm leaning on this side, right? Or, it could come from a multitude of things. It could maybe you work and you stand, and maybe you just shift, right? Maybe you just kind of lean one hip here, and you can see that I got this slope going on. It can come from anything. So you got to kind of think about that, kind of put that into practice and be like, hey, I find myself shifting here, I got to pull myself back to center. And that's a big part of all this stuff, right? Like, you can do the exercises, you can do the drills, but we want to find ways to take this back to real life and make you a better mover outside of your exercise environment. It's not just about doing the exercises, it's about becoming a little bit more mindful of how we do things, and that plays a really big role in all of this.